Hi everybody, I'm Sauk Valley Media Assistant Sports Editor Christopher Heimerman. Very spoiled today to have a special guest with us, Dr. Michael DeFranco from CGH. He's here to chat with us about our series that we're working on, The Hidden Injury. It's a series focused on the subject of concussions. We're going to chat about the wonderful things that he and the people over at CGH are doing with their sports concussion program that was recently put together. Thank you very much for joining us. Let's dive right into it.
Thanks a lot, Christopher. Pleasure to be here.
Let's talk about the program that you guys have been putting in place over at CGH and talk about the goals that come along with that program.
Basically, CGH has put together a concussion program for the community, athletes, the parents, and the coaches. There are really three goals of the program. The first one is education. We want to get the information out to the athletes, the parents, and the coaches so they know more about concussions, they know how to recognize them, and they know where to go for treatment. We developed a lot of educational material, including things like this binder, which we call the Playbook, that has a lot of basic information about concussions in it. We've developed lanterns like this about common symptoms and signs of concussions for the coaches, but we have posters and all kinds of stuff that can be used that make the information readily available and easy to understand for any level of person, even people without a medical background. That's who it's intended for. So educating the community is the primary goal of this program. The second one is to create a communication network. So what we've done is we've gone out to all the high schools and met with the athletic director and or the principal, and we've asked them to assign the responsibility of the high school having a concussion representative, so that if there's an athlete at that school who gets a concussion, that concussion rep is made aware of it, and then they can make one phone call to the concussion clinic at CGH Hospital, and we can coordinate that athlete's care. It doesn't matter if they have a doctor within the CGH system or not. It doesn't matter what their insurance is. Basically, they make one phone call and we will coordinate their care. We get them set up with a primary care doctor. We'll make a determination about whether or not they need to see a specialist like a neurologist. We make a determination if they need a CT scan or an MRI of their brain, and then we basically make a plan for a clinical treatment program for that athlete and follow them as they recover. And ultimately, a part of that treatment plan, which I'll get to, which is actually the next goal, is to deliver quality medical care to these athletes.
Right.
Part of that is deciding when and how the athletes get back to play safely after they get a concussion. It begins at a time we believe, which is preseason. So let's just take for an example football season. We think that sometime before preseason, just like athletes are required to get a physical evaluation to check out their heart, their lungs, their muscles, we think that assessing their brain function should be part of that. And we have a test that we call the SAC test, the Standardized Assessment of Concussion Test, that asks them some basic questions to assess their memory and orientation and concentration abilities. The beauty of that test is that if you do that at the beginning of the season, then that athlete has established baseline of what's normal for them. 2 weeks into the season, if they get a concussion, then we can retest them and see where they are with their score. Mm-hmm. And then we will sequentially give that to them as they follow their clinical care guideline in terms of getting back to normal. And that's one of the criteria that we use to help us determine when they get back to normal, as we see their scores start to normalize.
So incredibly important because no two cases are the same.
No, they're not. And so that's kind of the beauty of it too, is that we've outlined some criteria for the students to get back to play. No two athletes are the same. So one athlete might pass 1, 2 of those, the first two. Another athlete may get caught up in the first two. So that's kind of the beauty of the system. We've got these criteria outlined, and we're teaching the coaches and the other doctors in the community to use that in terms of when to decide how to get an athlete safely back to play.
Now, a couple of years ago, the landscape in the IHSA changed a little bit in this regard. Some laws were put into place saying, that a student or that an athlete needed written consent in order to go back out and play. So that's been in place, but what you're providing is the specific criteria that all these athletes need to pass. And it's my understanding that if any of the phases, if they shouldn't pass that phase, it's 24 hours of rest and then back to square one. Is that correct?
Correct. So that law was really a big step forwards in helping to protect the athlete. What we're saying is we're just trying to supplement through this program with these criteria saying, okay, make sure that the athlete gets an appropriate care treatment, care plan. If they get to the point where you say, okay, it seems like they're back to normal, look at these criteria and go through them. And then if they pass them, then they can get back to play. So just having a note from a doctor saying, hey, how do you feel? Are you back to normal? And signing a note saying, you know, if the athlete says, yeah, I feel like I'm back to normal, just signing a note, we don't really feel like that's adequate.
I got a chance to catch up with a family this morning, and their son, unfortunately, suffered a couple of concussions, and you know, along the line, they did get some medical counseling and some medical care, and you know, they got some advice that you know isn't nearly up to snuff with what your program is doing, with what you're doing. We're not just educating athletes and families here, is my understanding. I mean, even the medical the medical field needs to be educated as well. Is kind of my perception. Is that a safe point?
Absolutely. You know, they estimate that just on the high school level, there's somewhere around 400,000 of these that occur every year. The numbers, no matter what you look at, what study you look at, probably underestimates that problem. One, because athletes aren't always honest about their symptoms, so these kids might get hit in a game. They might get hit in practice. They might be having nausea, dizziness, and they might not say anything because they want to play. They don't want to miss their playing time. Another reason is that coaches and parents might not be knowledgeable about these concussions, like this example you've just given. So their son or daughter may be experiencing symptoms, and they don't put two and two together, recognizing that, hey, this is a concussion, we need certain care for this. And the third reason is, like you said, even doctors can miss it.
And it's unfortunate that it comes to the point where you need NFL players who are incapable of walking. You look at the extreme scenario, a Junior Seau taking his own life because of the after effects of playing football. And again, like you said, you know, and in this series, you know, the hidden injury that we're putting together, our intention in no way, shape, or form is to scare anybody about it. But the fact is, you see more diagnosed concussions now than ever before. And I think that that's because of the awareness that's been created. And it's because of the fact that more of them are being diagnosed. There aren't more concussions that are being suffered. It's the fact that people are aware of it and they're taking care of themselves. So, you know, I know that that's your goal, and it's very exciting to get a chance to work with you from the paper standpoint in order to create more awareness on the subject. So I know that you guys have put together seminars, and I understand that those went really well. You know, obviously we're trying to do what we can on our end, but how do we continue to create that awareness? As
the next school year approaches and the next football season approaches, we'll be offering more seminars at CGH Hospital. Personally, I'm available if coaches want to call me. I'm available to come and talk to your teams about this important issue. Our office, the Concussion Clinic, should be looked upon as a resource in the community. So if there are questions, if you want a copy of this playbook or any of the educational material, just call our office. We're happy to send you any of it. And like I said, I'm happy to arrange to make a time to come and talk. Like I said, it's important for people to understand this issue and then to kind of help at whatever level they're involved in athletics to get the coaches, get the administrators at the school on board with really making everybody knowledgeable about this and being aware of who the kids are who get a concussion so they can get the appropriate care.
You know, the name of the series is The Hidden Injury for a reason. It's the fact that, you know, if you run a CAT scan, if it's a mild to lesser concussion, you're not going to see anything. And I think what you're talking about right now, second impact syndrome, what we want to avoid is ever seeing anything when it comes to those scans.
Correct. We're trying to prevent those athletes from ever having to get to the point of needing a CT scan or an MRI, or that's really a critical situation when an athlete has reached that point.
I know that the Sauk Valley is very, very blessed and very fortunate to have you here. So
thank you very much.
I want to say thank you very much for helping us out with this series. You've been an enormous asset so far, and look forward to working together with you over the next few months and getting the word out as best we can.
Me too. Thanks a lot, Christopher.
All right. Thanks, Dr. DeFranco.